My name is Jessica Bankston, and my presentation is over coronary heart disease. I'm going to tell you about the disease, strategies to treat it, and where it is found to have the highest rates. Coronary heart disease, also known as coronary artery disease, is a disease in which a waxy substance called plaque builds up inside of coronary arteries. These arteries supply oxygen-rich blood to your heart muscle. If the flow of oxygen-rich blood to your heart muscle is reduced or blocked, a heart attack can occur. Over time, coronary heart disease can weaken heart muscle and lead to heart failure. According to a study of prediction of coronary heart disease using risk factor categories, recommended guidelines of blood pressure, total cholesterol, and LDL cholesterol effectively predicted coronary heart disease in a middle-aged white population sample. Warfarin is an anticoagulant. It prevents blood clot formation and their migration in the body. Warfarin was approved for Metoprolol is a beta blocker that prevents angina and reduces high blood pressure. Angina is chest pain caused by your heart when it doesn't get enough oxygen-rich blood. Amlodipine is a long-acting calcium channel Turkmenistan and Kazakhstan differ in several ways. Turkmenistan is only slightly larger than California, filled with sandy deserts and a few mountains along the border. On the other hand, Kazakhstan is slightly less than 4 times the size of Texas. There are vast steppes in the west, mountains in the east, plains in the north, and deserts in the south. Kazakhstan also has natural hazards such as earthquakes and mudslides. Both countries have the same literacy rate that children of 15 years and over can read. Also, they both achieved independence from the Soviet Union in 1991. Turkmenistan defines itself as a secular democracy and a presidential republic. Their two largest crops are cotton and wheat. Cotton is produced mostly for export, while most of the wheat is domestically consumed. Although agriculture only accounts for 8% of GDP, it employs nearly half of the country's workforce. Exports to China, Ukraine, and Italy include gas, crude oil, petrochemicals, textiles, and cotton fiber. Imports Turkmenistan receives includes machinery, equipment, and chemicals. The monetary value of Turkmenistan's exports and imports differs greatly when comparing them. Kazakhstan has an advantage because they are a much larger country. They receive roughly $78 billion more from exports than Turkmenistan. Kazakhstan exports oil, oil products, natural gas, ferrous metals, chemicals, machinery, grain, wool, and meat. Kazakhstan has enormous fossil fuel reserves and other minerals and metals such as uranium, copper, and zinc. It also has a large agriculture sector featuring grain and livestock. Landlocked, Kazakhstan relies on its neighbors to export its products. A country's health can be affected by several factors, including environmental issues, lifestyle, and diet. Turkmenistan and Kazakhstan both experience environmental issues such as contamination of soil from agricultural chemicals. Coronary heart disease is higher in these countries because of the poor quality of medical care and poor treatment quality in hospitals. A study done by P. McGee confirmed that rates of coronary heart disease are higher in South Asians. They have excess risks that result from metabolic disturbances associated with insulin resistance. It is also said that psychosocial factors may play a small role. They are low-income countries living under oppressive regimes. Turkmenistan and Kazakhstan both lead unhealthy lifestyles. According to an article in the Journal of the American Medical Association, diets using non-hydrogenated, unsaturated fats is the predominant form of dietary fat. Whole grains is the main form of carbohydrates. An abundance of fruits and vegetables. I hope you've become more familiar with what coronary heart disease is. It is caused by the buildup of plaque inside the coronary arteries. Drugs such as anticoagulants, beta blockers, and calcium channel blockers are taken for this disease. Your diet has a major impact on you, so remember to eat right and live a healthy lifestyle.